Hello, Dr. Sal Giorgianni here from Healthy Men and Healthy Families program. Going to talk with you today about the big T, testosterone, and 10 things you need to know about the big T. And this is not just a little bit of information for guys out there, because as we all should probably remember from our high school biology days, women have testosterone as well. By the way, my producer thought it would be a nice touch for me to wear a pink shirt while I'm talking about testosterone. So sure, why not? You let me know if it works for you. For me, whatever the producer says, they make me look better than I can. All right, so 10 things you got to keep in mind that affect your testosterone. First of all is the obvious one, age. The testosterone levels of a 5-year-old is not the same as a 20-year-old, is not the same of a 50-year-old, is certainly not the same of a 70-year-old. So age is one of those very important parameters that tell you if your inherent testosterone levels are correct. And it varies a lot by age. And if you think you're having issues associated with testosterone, which is important, not just for sexuality, but also for heart health, for muscle development, for proper utilization of nutritionals, for proper formation of other hormonal functions, even cognition, brain health. If you think you're having problems, have the testosterone levels tested, and then you have to interpret them based on your age. The next one is sleep. How does quality of sleep affect testosterone levels? There's some very interesting data which tells us that testosterone levels are related to the extent and quality of sleep. This can be a problem for individuals if you're shift workers, if you travel across time zones, like in the airline industry or transportation industry, if you have irregular sleep patterns because of other physiological or psychological issues. So it's not just how much you sleep, but also the quality of sleep. Are you getting good, restful sleep, lots of adequate amounts of REM sleep? Those are all things that affect how this very important essential hormone is not only released into the body, but how it's utilized by the body. Time of day. Yes, absolutely. The amount of testosterone that we have circulating around or pushed out is usually a little bit higher during the morning than the evenings. Now, that doesn't have an effect on everything, but it is something that you need to keep in mind as to when you are getting your testosterone levels measured if you are going through that diagnostic technique. So yeah, time of day is one of the other things that affects testosterone levels. Surprisingly, seasonal effects. Uh, it's not absolutely conclusive research now, but there is some research out there that shows that testosterone levels are a bit higher, particularly in guys, when it's warm and when it's sunny out. And when you just think empirically or just, about your own life experiences, you have a little more energy, a little bit more muscular, a little more active, a little more positively predisposed when it's warmer and when it's sunnier. It drops a little bit in the winter months or when it's dark out, or if you move from an area where it's usually bright sun to maybe the northwest United States where it maybe not be sunny as much as it was. So take that into account and how it affects testosterone. Here's one that gets overlooked even by physicians, pediatricians, is the new daddy effect. Yes, once you have a new baby, uh, everything in your life changes, particularly if it's your first. But one of the things that changes is your testosterone level. It may be related to our evolutionary needs, that the testosterone levels, when you bring a new baby home, they drop for a period of time, maybe a month, 2 months. It's not adequately studied to say definitively, but there is a perceptible drop. It's the daddy penalty, if you will, but it does allow us to focus a little bit more on the child than other masculine activities. That quickly raises up again, so it really doesn't have a long-lasting effect. But just be aware that testosterone levels right after you bring your newborn, whether it's your first, second, or third home, they drop a little bit. Um, Physical stress. Uh, don't have to say too much about that. I think we can all understand how physical stress has an adverse impact on so many things of our lives. And let's not forget hormonal secretion and production of hormones, and hormonal secretion is a direct function of how positive we feel, how stressful we feel. So, stress is another thing that's going to affect your testosterone levels. Long term stress will have a long term effect on testosterone. So, that's the key thought here. Um, Mental status, that's the kissing cousin to stress. It can be depression, it can be excitement, it could be joy. We just did a program on positive psychology and how looking for joy in our lives is a very important thing. It also will have an effect on testosterone secretion and utilization of testosterone. So, a joyful outlook will be a positive thing to help you. Diet and environment. Sure, we talk a lot about diet. We can't get away from the fact that we are what we eat. If we eat good, wholesome, healthy, well balanced meals and nutrition, we'll have good, healthy, wholesome outcomes in our body development and our energy levels. If we eat bad stuff, it won't go so well for us. But also in the environment, we have to be aware of the environment. There was, for example, a trend to be using soaps and cleansers that were bactericidal back in the 90s and 80s. And what we found is that those bactericidal soaps were producing false signals that were actually turning off testosterone production in the body. Some other things, insecticides, environmental toxins, they too can cause a drop in testosterone, as well as some effects on sperm production if you're thinking about conception. So, if you have a low testosterone level, it's not only something that may be do internally, but it may have something to do with environment. So if you're looking at a problem with testosterone levels, think of all the things that you use in your environment or in your environment, and that may help your doctor decide what what is the etiology, what's the cause of low testosterone levels for guys as well as gals. Um, Substance abuse. I don't think we need to say too much about that. In particular, opiates, alcohol can also have a detrimental effect on testosterone levels. So, not moderation, but I think when you move into the area of abuse of substance, any substance, it's going to have an adverse effect on how your body performs. And testosterone being a hormone, it depends on how your body performs overall. And last but not least, medications, prescription medications included. There are a lot of medications used for cancer treatment. There are medications in particular for prostate health management in older guys. Some anti-inflammatories can reduce testosterone levels. Uh, these lists are well known to your physician, to your pharmacist. So again, if you believe you're having problems with testosterone, go through the exercise of being very, very good about cataloging all the prescription, non-prescription, and yes, herbals that you consume because they may be part of the reason that your testosterone levels are lower. Um, be informed, be proactive. Having your testosterone levels measured and adjusted for age, lifestyle, and circumstances is the best way to keep the big T testosterone at optimal levels for your lifestyle and your age. So please take a look at us on our website at www.healthymen.org and also take a look at our YouTube channel at YouTube, looking at Healthy Men Inc. And we have lots of very good information about lifestyles, health for men and those who love them. Thanks for tuning in. Dr. Sal Giorgianni here.